Hi everyone, welcome back to another episode of LECOM's Heroes in Training. I'm Kathleen Spinazzola, your host. Today we have Dr. Zboyovski, Dr. Katie Zboyovski, Assistant Professor of Pharmacy Practice here at LECOM Erie. And this is Rachel Zurn, first year pharmacy student. Welcome.
Thank you. Thanks for having us.
Thank you so much for being here, both of you. We wanted to speak with people in the pharmacy department because October is American Pharmacists Month. And within that, we are raising the awareness of the vital nature of pharmacists in our community. Do I have that right, Doctor?
Yes, to say the least. Pharmacy world is growing. It's more exciting than ever, so it's a great time to try to find out more information. Or if you're just think you have a basis understanding, think about talking to your local pharmacist or, outreach to our school. We're always more than happy to answer questions, help lead you in the right direction, which Rachel, I'm sure, can talk about on her behalf on her journey. But yeah, pharmacy is expanding. We need more pharmacists, and you can do more than you can imagine with the degree that you will get.
That's so interesting because I feel like that's all we hear now is that the role of the pharmacist in communities is, besides that it's vitally important, but it's actually expanding. All right, so let's talk about that more later. Let me get to you, Rachel. Tell us a little bit how, you got to us, how, your journey to pharmacy began.
Yeah, absolutely. I mean, I have a bit of a unique perspective because I have a family member who's a pharmacist, so I got to see firsthand a lot of what he did in pharmacy, and then from that I had the opportunity to talk to a lot of different pharmacists in different fields and just kind of find out what their role is, and that is what really interests me about the profession.
So you've seen firsthand how it all goes.
Absolutely,
what
yes.
a pharmacist does day in and day out,
Yes,
and that kind of thing. Oh, that's so interesting. So let's talk then a little bit about how the role of the pharmacist has expanded, because gone are the days, right, of a little person behind a counter counting pills, never to be seen or heard from again, or whatever. Right?
Yeah, we should hopefully, to all of you, not be this mysterious person just counting and dispensing pills. That is far beyond what we are able to do now. I'm going to throw out some words and we can describe them as we go. But immunizations, so vaccines. Pharmacists are the most sought out and most easily accessible, not only for your medication realm, but health and well-being, including our vaccines and immunizations. Medication management, medication reconciliation. We look for adverse drug reactions or reactions with potential food and other drugs that you're taking. We want to monitor your just your overall health. We can take your blood pressure and help and work with your providers to make sure that we are all on the same page and make sure that we're utilizing and maximizing the potential of your medication as well as those non-pharm issues as well.
Whoever thinks of all of these things until the moment that you need it.
And I could keep going.
I know. Tell us, Rachel, so I'm sure growing up then, seeing, having a pharmacist in your family, is that right?
Yes.
You probably, did you think, here's how I could make a difference in this profession?
Yeah, absolutely, because I've always been kind of drawn towards healthcare, and then being able to witness exactly what a pharmacist does for the community has really driven that to be, my interest in the healthcare field.
Is there anything that excites you the most about sort of diving into this profession?
Honestly, the problem-solving aspect of it, the clinical problem-solving, getting to work with different healthcare providers and patients directly.
I see.
Yeah.
I see. That's interesting. So tell us now, Dr. Zboyovski, tell us a little bit about your journey into the world of pharmacy and how you got to us.
So I think every story is unique, and don't feel that you have to have that cookie cutter experience. Mine is far beyond that, and I continue to learn and grow every day, and blessed, so grateful for the opportunities that this school alone and those around me have provided to me and continue to do so. So the support here is exceptional. You can't match it. But my path, I did 4 years of an undergraduate, got my bachelor's degree in biology. I then took a little break. and then went back to school. I did our post-baccalaureate program based in pharmacy, and then that helped get me ready and get me prepared for a full curriculum that's fast-paced. So I did our Erie campus, which is accelerated. We do the program within 3 years. I did that. I also dual enrolled in one of our master's programs.
Amazing.
Health Service Administration. I dual
That's
enrolled my 3rd year. So then I graduated the following year with that. I also utilized our various resources and did a residency at LECOM Medical Center.
Fantastic.
I work at our outpatient pharmacies. So just know that it doesn't have to be exactly the way that it should be planned. That it's okay to go through those little moments in life, and it's still waiting for you. If you want it, it's here.
Like you said, everybody's story is unique. Everybody has a different sort of way of getting to where they are at in life. It's just great that the opportunity is always there. The door is always open. If you're like, this maybe is what I want, I'm not sure, you can come and find out. How are your classes going, first-year pharmacy student?
They're going well. It is absolutely.
What do you have right now?
Oh, right
Like,
now,
no idea.
yeah, I am in, it's called BMS 2, so we're starting to learn about drug interactions and drug receptor interactions, learning a bit about pharmacy practice as a whole, kind of the impact of community pharmacy and industry pharmacy and just all the different fields, being exposed to that, as well as picking up on some lab skills. I believe later this week I'm going to start compounding for the first time, so that's a new skill I've never had a chance to do.
That's neat.
But yeah, just like a lot of stuff all at once. It's fast paced, but it's very enjoyable.
Yeah,
So,
yeah, that's terrific. I know, and you have our thing at LECOM is that our faculty always have an open door, so if you need anything, they're there.
You just ask.
Yeah, absolutely.
Yeah.
Which is terrific. I
It is.
imagine, especially when things are at an accelerated sort of pace, you need to like make sure you're not
Hone in.
leaving anything back. Right, exactly.
Right. They have all
Hone in.
been very helpful. Everybody
Yeah.
is insanely helpful.
Oh.
No,
That's
they
amazing.
were. Same experience, though, as
Yeah.
a student.
Oh, that's
Yes,
terrific.
wouldn't change it for the world.
I was going to ask you also, Doctor, about, because community service is part of, it's at the core of our mission here at LECOM, and the pharmacy department participates in a program called Script Your Future, which is nationwide, am I right?
It is.
Tell us a little bit about Script Your Future, because again, it's at the heart of everything we talk about with community service and what we stand for and value here at LECOM.
So that coincides with my personal values. I am big into public health and volunteering and community service and just education to everyone that will listen, I guess, if you will. Script Your Future is near and dear to my heart. I have to be honest, I didn't participate as a student, and now that I know how amazing it is as a faculty member, I wish I could go back. But with that said, I now have the great opportunity to like Rachel,
take the students, right.
to take them under my wing and actually learn from them as well, and then touch the hearts of as many people as we can. So Script Your Future, I am happy to say for the past 3 years, we have won one of their 4 awards that they provide
Which is
every year.
amazing.
Yes, it was very exciting. This campaign season will start in January. It lasts 3 months, and we tried to cram in as many community service events as possible. We like to have themes sometimes, so get creative with our students, work together of what is our major goal this time, who really needs our support, and accessibility. So trying to engage as many people as possible and the
Different
students.
populations
Yeah.
within the community, right. Tell us a couple of the, because I know that you and the students this past year, and you're next, put in so many hours with different populations around the community, providing different services such as
So this past
a lot of education and immunization.
We
Sorry.
did. No, you're spot on. Thanks for the guidance. We have done, last year was across the ages, so we wanted to hit all of the individuals as from every age range as possible. So we went to the young kiddos in our elementary, middle school, and high schools in the local surrounding area. We also looked at our older adults, so lots of long-term care patients or residents, those in independent living, personal care, or skilled nursing care. We wanted to give them lots of time as well. And then we also invested in ourselves and as students. So tried to improve our understanding in education surrounding these populations.
Right.
Again, also looking to those in rural settings who have limited access to care. So that was a huge component.
Yes, yes.
Vaccines, blood pressure, so talking about hypertension, chronic disease management, how they can do that themselves, and how to be a strong advocate, how to understand how to read a medication label, to know what a pharmacist does, and to build that trust and relationship with their own personal pharmacist is very, very valuable, and still is. So
Right.
please do so.
As we were just speaking about a little bit earlier, especially in underserved areas, which again, here at LECOM, all of our future healthcare professionals this is something that's near and dear to our hearts, as Dr. Zboyovski said, to make sure that we are able to care for people in underserved areas. And sometimes a pharmacist is the closest thing that a person may have to any kind of clinical care or anything.
Yeah, I think the last statistic, and I think it's a little outdated, probably from the early 2020s, but about 90% of the population lives within 5 miles of a pharmacy or a pharmacist. So making sure that we maximize the services that we offer,
Right.
especially in those communities who,
Might be 30 miles from the nearest
Right.
hospital or doctor's
Yes.
office or
And
something.
oftentimes pharmacies have expanded hours, so that also equates to availability
Right.
for these individuals.
Right, right. It's an amazing
It's great,
thing.
yeah.
So do you think you want to stay in the community, Rachel, or what do you have your sights set on?
Yeah, absolutely. So
And if it's to move away from home, we won't tell your family. I promise we won't tell your parents. Just kidding.
yeah, I mean, I'm honestly kind of just waiting to see where my rotations will take me. I have the opportunity to do both community and institutional rotations here, so kind of wanting to build on those experiences before I make my final decision.
Sure,
I am
sure.
leaning more towards the clinical route right now, but that is all subject to change.
Of course,
Yeah.
of
It is.
course. I mean, and your
I
mind
still
could
don't
change
know.
a few times,
Absolutely.
right? Right,
Yes.
as you sort of go down the path.
Yeah.
Anything could happen. So let's see, what else did I want to ask you about as far as Script Your Future goes? Shoot, there was something else I was thinking of. It strikes up again in January, right?
January, yep, January to March.
And students who want to get involved, what do they need to know, or what do they do? Just sign up? Or?
Yes, sign up. Ask a faculty member or state that you're interested, and we'll help guide you to the right person. Always feel free to reach out to myself.
Right.
And the options are endless. It's a great way to get yourself out there, push against your norms even. So if you're kind of frightened to talk to patients or unsure, you don't have to be the expert yet.
Right.
So take
But you
these
have
moments
information to
and
give.
yes,
Yeah.
there's skills to learn, and people need you. And even just the simple interaction is so powerful. So don't limit yourself. Please reach out.
It's very moving.
Yeah. Oh, one more cool thing is that it's one of the times that we try to incorporate the other professions within our school. So the ability to work and interact with the dental students and faculty and staff, podiatry, the medical students, even our PhD master's programs, we try to incorporate as many of them as much as possible, because pharmacy isn't everything that we can tell everyone. It is great.
Like in a vacuum, right?
Yeah.
You sort of have to be multidisciplinary, and I know, there's a big word for you, thank you.
But it's important. So they're gaining, students at least are gaining those skills to work with other healthcare providers,
Right, because you have
building
to.
trust within ourselves so that all of our professions can advance. We need to maximize each of our abilities and our skills. And it's a great starting point.
The learning that must happen on the students' level as you're just going out into the community and doing these things must be amazing. I mean, it's the kind of intangible
You can't
thing
beat it.
that you can't measure, really,
But
right?
You can see it happening, and as a professor, I guess, if you will, or advisor, it is just awe. Like, I can't explain the moment in words, and there's so many of them, so it's a spectacular time.
I know, as I say, and even talking with other students, I know they've all had very moving experiences in participating in Script Your Future. It's pretty amazing stuff.
Yes.
Without question,
say.
I know.
Yes, yeah.
Rachel, talk to us a little bit. If I say I am thinking about going to pharmacy school, tell us a little bit, if you can, about, you know, how it all began for you, from the application process, admissions, and that sort of journey, because that's kind of a journey unto itself, right?
Yeah,
the admissions
absolutely.
process. Tell us a little bit how that went for you.
Yeah, so I think an important thing to consider if this is something you're maybe interested in is getting some firsthand experience in a pharmacy, or even just shadowing a local pharmacist, just trying to make those connections and find out if this is really something you want to pursue. That was the first thing I did. And then as far as the application process went, it was pretty simple. I didn't complete a 4-year degree before coming here, so it was really just gaining the prerequisite education.
And what did that entail?
It was, I want to say like 54 credits. It was a lot of your biology, anatomy, chemistry, mainly organic chemistry. That's
that
a
makes
tough
sense.
one. But
You can do it.
Yeah, absolutely. Very worth it. It was great, and I am happy that I made that decision. So, yeah, the application process was fairly simple. There are a couple of deadlines. So you have a lot of opportunity to, take your time, collect your letters of recommendation, and then, yeah, it's a fairly simple process, I'd say.
That's good. That's good. And you didn't have to pack up and move across the country
Correct.
or anything, so that's terrific.
Right. And there is that option for students who want to do distance education. I'm in the
Right.
Erie pathway, which is accelerated, but I did interview with some students who were candidates for the distance education program, and that is super beneficial if you are from somewhere that's not Erie or Florida. Then you have the opportunity to kind of like learn pharmacy from home.
Right. Amazing. Amazing. Well, thank you both so much for being here today.
Thank you for having
We're
us.
celebrating American Pharmacists Month and the vitally important role that pharmacists play in our community. And I'm super excited to have met you today.
I'm so
Thanks,
thank you too,
Rachel.
of course.
We'll see you next time. Remember to like, subscribe, and follow us on all the usual places: YouTube, Facebook, Instagram, Twitter /X. And wherever you listen to podcasts, we're broadcasting there too. So thanks. We'll see you next time.